Medical doctors, nurses, and workers in other ancillary services in Nigeria's health sector have continued a steady stream of professionals quitting their jobs and taking their services abroad. Now, this follows the inability or unwillingness on the part of the government to resolve fundamental issues affecting the welfare of workers. Resident doctors in Nigeria have severally called for an improvement on their take-home pay as well as their hazard allowances. Because of the COVID-19 pandemic, all to little or no avail. Well, joining us now to have a conversation around the rise in the brain drain by medical doctors and what implications this may be having on Nigeria's healthcare sector is Dr. Godiya Ishaya, who is a president of the National Association of the Resident Doctors. Thank you so much, Dr. Godiya, for joining us this afternoon.
Good afternoon, and thanks for having me.
Yes, well, we're talking about the brain drain that is currently plaguing the healthcare sector. What are the implications if this goes on unabated?
Well, thank you once again. The implications are that we have to keep on having poor health indices, and the vicious cycle of our colleagues immigrating outside the shore of this country will continue unabated. You agree with me that before uh, 2 years back, we used to have the doctor-patient ratio was a little bit better, but it keeps getting worse. So that means more doctors, or rather the remaining doctors that are within the country will have to overwork themselves in order to cater for the teeming patients that are coming to seek for medical services in our various hospitals. And of course, the attendant burnout is a syndrome that our members have had to cope with. Is actually leading to a lot of assaults directed towards our members. Like this year alone, the study that we did by our Research and Statistics Committee showed that there were about 345 incidents of assault targeted on the doctors. And those targeted assaults were mainly as a result of patients having to come and have a long waiting time, and also because of fatigue and that the doctors have had to endure. They are easily irritable.
Well, we've been speaking with Dr. Godiya Ishaya, President, National Association of Resident Doctors, to talk about the brain drain in the nation's health sector. Of course, we know that medical doctors, nurses, and workers in other auxiliary services in the country's health sectors, they've continued a steady stream of we've had a steady stream of professionals quitting their jobs and taking their services abroad, probably due to the poor conditions of service. Here in Nigeria. They've severally called for an improvement on their take-home pay as well as hazard allowances because of the COVID-19 pandemic, all to little or no avail. So as soon as we reconnect with Dr. Godiya Ishaya, we'll be having this all-important discussion.
The fact remains that if the brain drain continue unabated, the health care indices will continue to go from bad to worse, as we have already started noticing it in the various indices that have been released recently. The implications of the brain drain have been have impacted negatively on the health system, both on the remaining healthcare workers who are on ground and also to the teeming patients that are coming to seek for health services in the various hospitals. On the part of the healthcare providers, of course, just as I was saying, a lot of our colleagues have had to suffer burnout syndrome, varying degree, which of course are the reason why we have started noticing a sharp rise in level of violence targeted against the healthcare workers. When patients come in or when relatives come in with patient, they expect that they are seen within a very short time as possible. But of course, since the personnel are not adequate on ground, the waiting time for the patients have had to increase. And of course, working at such a condition have met a lot of our colleagues to have to suffer a lot of violence targeted against them. Like I was saying earlier, that we have recorded over 345 cases of violence targeted toward our colleagues because of probably a patient have come based on what were actually found out during the surveys. Most of the time, the violence come when the patient relatives bring their patient and expect that they are seen within the shortest possible time and they are not given those attention. Of course, because of the shortages that we have had to endure because that have been occasioned by the growing brain drain that have continued unabated.
Dr. Ishaya, Dr. Ishaya, now you've painted a very rather gloomy picture, but the Minister of Health, Dr. Osage Hanire, says there are enough medical doctors in Nigeria and that the federal government is working towards replacing any medical doctor who resigns and relocates abroad. So what's your take on the minister's position? Dr. Ishaya, I'm asking for your take on the minister's position that Nigeria indeed has enough medical doctors and the federal government is working towards replacing any medical doctor who resigns his job and relocates abroad.
Such a time that our colleagues who have exited the program are replaced, we will say that we do not have adequate doctors on ground. Even with the assertion that was
Well, it seems we're having very poor internet connection with Dr. Godiya Ishaya, but we do appreciate your coming on Newsday. President, National Association of Resident Doctors, thank you so much for joining us on Newsday.